You've joined MS World. I'm Dr. Daniel Kantor, standing here with Dr. Gary Cutter, who is professor of biostatistics at University of Alabama at Birmingham, and also the director of the Coordinating Center for NARCOMS. Dr. Cutter, thank you for joining us. One of the things we hear about sometimes is something called comparativeness, effectiveness. What does all that mean?
Well, comparative effectiveness is just comparing two treatments to see if one works better than the other. And ideally, we like to do this in clinical trials. That is the Cadillac or the Mercedes way of doing studies. It's also the most expensive way. And it takes multiple years to do these kinds of studies. And in MS, it's even more complicated because the changes we see over time are very slow. And when you have two effective drugs, they're even slower, which means longer studies, larger studies, and we can't afford to ask those kinds of resources to be placed for every question we want to raise. So another way to go after questions like that is to look at individual medical record databases, insurance databases, places that have what has happened to patients and participants over time. They're anonymous, but they can see where drugs are changed, maybe why, what the reasons are, and from that try to make sense, is one drug better than another, and under what conditions is one drug better than another. Some of the problems that that's the promise of the automated medical record, or EMR. These electronic medical records have tremendous information in them that we can possibly utilize to get faster answers to questions, because we can enroll many more patients and see how things are changing more rapidly. The problem that we have is when things go into changes that are not medically related, such as formulary changes. A pharmacy can no longer prescribe drug A, but they can only look at drug B. That adds noise to what's...
Okay, so what you mean is that when somebody's switching medicines, it's not always because the medicine's not working. Sometimes it's because of other reasons. It's because the insurance changed or something else changed.
It might be cost. It might be because one drug is going to be substituted for another. They might be in the same class. They may not be the same class of drugs working in the same way. So when you have this, this is what statisticians call adding variability, and it's an extraneous. It's not information that we're interested in terms of the question we're trying to answer about which drug works better. And that makes it harder to see whether or not there's a difference in the performance of one drug versus another. And with the tremendous changes that are going on in the American healthcare system right now, this is, of course, needs to be watched, because we may be making it more difficult to find out what's going on. Now, NARCOMS is a registry, so we go to the patients directly. We're not, we can ask, why did you change? Whereas medical record databases often don't record an exact reason. It's an insurance claim, they noticed there was a change, there's a reason, but it's not getting down to explicit reasons. So in NARCOMS, we're going to be focusing on, why did people change? Was the change because of the change in your condition? Was it because the physician thought there was a better drug? Was there a change because your insurance company would no longer cover this? All of these we're going to be trying to focus on in our next few semi-annual updates.
So for NARCOMS, if somebody wants to get involved, what do they do? Is it something their doctor puts them in? Is it something they do themselves?
No, actually we are a patient driven research project where the patients enroll directly into NARCOMS. It's narcoms.org, and we ask them to participate. We keep their data private, we keep it anonymous, we use it for research purposes. We rely on them to give us information to help us answer these questions in a rapid way. We have a large number of participants who've been participating for 15 years now. We get new people each year, and the more we can get, the easier it is for us. It's all web-based. You only have to commit to 2 surveys a year, and they take a half hour or so, but you can do them over multiple days to minimize the amount of effort that you put in. And we return a magazine called NARCOMS Now that at least gives you some information about what's going on, and a way to reward you or thank you for your participation in NARCOMS.
So if you're interested in getting involved in research and you're not that interested in getting involved in investigational research where you get a medicine and it's being tested, if you're interested in those types, go to clinicaltrials.gov and you can find out about clinical trials near you. You can speak with your neurologist. But if you're interested in helping the world of MS by answering questions about your multiple sclerosis and also about why you may or may not be switching medications, please visit narcoms.org. Thank you, Dr. Cutter, so much for joining us once again.